Hey, this is Kay, and today we're going to be talking about what nurses do in their spare time.
Does the size of the facility matter?
You know, in a larger hospital, 500 plus beds, you are the receiving hospital. You're not the transferring out hospital. You're the receiving hospital. You're going to get patients all day and all night long because you don't have just the local people that's coming into the ER. You also have transfers that are coming in from other hospitals that you have to worry about. So, do you have spare time? No, you're lucky to be caught up with your charting by the end of the shift. Now, in a medium hospital, we're talking about 100 to 500 beds. These type of facilities may have a little bit more downtime, but still, with all this electronic charting, you have to take your paper towel that you wrote everything on and transfer it over to the computer. So, do you have time to play cards and Farkle and all that other nonsense? No, you have charting to do. The smaller and critical access hospitals, you know, we'll say 25 to 100 beds. The reality is that you don't have very many nurses that are on board. You know, your staffing ratios are usually 6 to 8 in these type of places. You have a few nurses in the ER. You have a few nurses on med surg, OB, ICU, if you have even a little OB or an ICU. But whenever something happens on the floor or in the ER, it's all hands on deck because you don't have a very big pool to draw from. So is there any time to spare there? Not really, because I guarantee you just never know what's going to walk in that door.
Do all nursing specialties have downtime?
Specialty wise, are there some specialties that may have a little bit more downtime than others? You know, with downtime means that you're not really busy at the moment, but still you have call lights to do, you have charting to do, you have people to take care of. It doesn't matter if when you're on that floor, you have patient responsibilities unless somebody actually physically has a break nurse, another nurse that comes in and takes responsible for your patients. A lot of places, they still, okay, you cover my patients while I'm gone. Well, that gives a nurse your 6 and her 6. So that nurse has got 12 patients, and that's not right either. You're not going to get a true break on that. You know, and the only thing with the units is that maybe in labor and delivery and ER, they work on a feast or famine a lot, and in that, you know, they do have trends to where everybody just, boom, enters the ER and you've got 40 in the waiting room and you're all full in the back. So you just never know what's going to happen. And, you know, they may slow down from 2 to 5 a.m., but still, you've got all your stocking to do. If you got time to lean, you got time to clean. So you got stocking to do, you got cleaning to do. You need to make sure that you have all your supplies in your room. So do those people get a break? No, they may not have any patients in the ER, but still they have things that they must do. Same thing with labor and delivery. You may not have any mamas in labor for a couple of hours, but you just never know what's going to walk in that door, and you have to be there. You have to be ready to go at a moment's notice.
Do all shifts have downtime?
And then there's shift work. I've actually got this separated in between days, evenings, and nights. I've actually worked all 3 shifts through different contracts. So the one where I worked day shift, I had 6 to 8 patients on a telemetry floor. You had to hit the floor running. You had to get all your blood sugars. then you did your assessments, passed meds, doctors make rounds, then you had to take people to x-ray, you had to take people to CT scan, then you have to give more pain meds, and then take another set of blood sugars, and you have breakfast and lunch that you have to serve. What? When is there time for downtime? You're lucky enough to get a bathroom break. And if you're really lucky, you're going to get to take your Slim Fast to the bathroom with you. That's crazy. There is absolutely no way that you have downtime on a day shift. On evening shift, you do your assessments, you pass your medications, then you have supper, then everybody wants to go to the bathroom all at the same time. They all want their HS meds, they all want their pain pills and their sleeping meds, and it just goes around and around. So by the time you get all that stuff done, you may get to chart for a little bit, but besides putting out fires and answering call lights, and that's all you get done on evening shift. And night shift, well, yeah, they all sleep at night. Wrong. No, they don't sleep at night. They're up all night because they're worried about what their test results were, or what's going to happen tomorrow. Is their surgery going to be okay tomorrow? At the beginning of the shift, you make an assessment, then everybody has to go potty again. When patients can't sleep, then they're anxious and they start to think. Then they turn the call lights into Jeopardy buttons. Always. They always need something. There's somebody who needs something at night. We do not stop running at nights, even on critical access floors. The patients have their call lights. In between 2 a.m. and 5 a.m., you may have some downtime, but a break? No, you don't have a real break because you have nobody to come in and take your patients. Card playing? No, I've never seen card playing at the critical access hospitals that I've traveled to. Never. I don't know. It's crazy.
What is the difference between downtime and a break?
Okay, so let's talk about what is the difference between downtime and having a true break. Downtime is whenever your routine patient needs have been met and you're waiting for PACU to call a report to you, or update from the ER on when your admit's coming, or maybe your radiology results are back. So you may be waiting on results and tests to get back, and you have some downtime, but you're sitting in front of a computer charting during that downtime. You may have time whenever the patients are resting with eyes closed, because you can't never say they're asleep because you don't know if they're really asleep. But then the bladder button goes off and disrupts their sleep cycle. So then you got to get up and take them to the bathroom. ER nurses may have some downtime between 2 a.m. and 5 a.m. in a smaller hospital. But the bigger hospitals, no, the patients keep on coming and keep on coming and keep on coming. And for you to get a break, there has to be a break nurse there that can totally take care of your patients while you're gone, which doesn't happen very often unless you're in California. What is the meaning of a break? A break is whenever you have somebody come in and you get off of the floor, you go to the break room, to the lunchroom, wherever, and you have absolutely no responsibilities for patient care for those 30 minutes to where you can relax. Have I seen this in hospitals other than California? Not very often, because in the other hospitals that we don't have mandated patient ratios, in the other, you may have 6 to 8 patients, and there's no way you're getting a break with that many patients, and everybody else has that many patients.
How should staffing be done?
And then there's the staffing mess. You have nurse to patient ratios. Legally, they are only valid in California. More states are looking at going to nurse to patient ratios. I personally think that we ought to have nurse to patient ratios the same as California nationwide, because there is no way on telemetry that I can take care of 6 to 8 patients properly. Yeah, I can make sure they get their medicines, and I can do an assessment and make sure that their call light is answered, but you don't have time to do proper nursing care. At one hospital, we actually staffed by hours per patient day, or HPPD. In this system, it ranked the patients on how much time that the nurses had to spend with that patient, and we had everybody divided up equally in the hours per patient per day. So everybody had their allotted number of patients. They either had 4 or 5 on the medical floor, and then everybody had an acuity number, and everybody's assignments was split up by acuity. Worked out great. The best system I've ever worked with. As a supervisor, the best plan of attack is to find out how many nurses you're going to need to cover your patient ratios. 5 on medical floor, 4 on telemetry, 3 on step down, 2 in ICU. Then you can divide your patients equally by the HPPD. That's the easiest way that I have found to divide up the nurses' care load, and you actually get semi-decent patient care. But it also depends on the amount of support staff you have between your nursing assistants and even licensed practical nurses.
What does this all mean?
What does all this mean? Do nurses have downtime? Some of them may. If you work night shift in a critical access hospital, then you might have some downtime. A true break, you're not going to get a true break, because unless the charge nurse doesn't have patients and gives you a break, that's the only way that you're going to get a break. Now, night shift does get a relief in the fact that you usually don't have families and doctors running around or administration running around. So you do get a little bit of a break there, but still, patient care, it's not any different from days to nights. You still have to make sure that patient is totally taken care of during the day and the night. Is this the norm for most hospitals and units? Absolutely not. There's only a few, as I said, really, there's only a few hospitals in California that I have worked at that they made sure that they got their 15-minute break, and then their 30-minute lunch break, and then 2 more 15s on a 12-hour shift. As a traveler, are you going to have downtime? You might, as a traveler, have downtime. The thing is that how do you use that downtime also? And what can you do? You work on educating yourself, especially for travelers. Get out the policy and procedure manual and read, because every hospital is different on their policies and procedures. This can be found either in paper form, but a lot of them now are found on the computer. Read on your policies and procedures and your phones. I know that you really need to have your phone with you because you have family at home in the middle of the night and family in the middle of the day. But be careful, because the patients and the families are watching. This is how some units get a, quote, bad reputation, because of the nurses having their cell phones out while at the nurses station or in a patient room. Absolutely do not have your phone out in the patient room. If you get a phone call or your pocket buzzes, then please excuse yourself and step outside into the hallway, or better yet, go to a private room to where you can see what's going on. But that should only be for emergencies. And what does this mean with breaks and downtime? Yeah, you may have some downtime, but the reality of having a true break, it's not there. It just doesn't happen unless you have a break nurse. Unless the hospital has a break nurse, you probably are not going to get a true break.
What can we do about it?
All right, folks, it's time to ante up. What are we going to do about all this? Not having a true break, maybe having some downtime. You need to go to your local and your state and your national nursing organizations and join them so that we can have mandatory patient ratios, mandatory staffing by acuity. I also have a petition link that I'm going to put below. Sign the petition. Let's make some changes here. We have to push these nurse to patient ratios. We have to push staffing by acuity. We have to push getting our education. We need scholarships so that CNAs can become LPNs and RNs can get their BSN or their master's or even their doctorate. You need to get some continuing education credits. There's just no limit to your learning ability. You may have downtime, but a true break, with no patient responsibility, unless you're in California and sometimes Washington or any other states that have a union, you might see that. But in the other hospitals that I've traveled to, getting a true break is far and few between. So why did I create this video? I want the public and nurses to know the difference between downtime and a true break. Be responsible for your actions, even if you only have 45 seconds to use the bathroom and maybe get a drink. Okay, guys, see you next week.